Good afternoon. This webinar offers closed captioning. To enable closed captioning, click on the live transcript button on the bottom of your screen and choose your preferred method. Welcome to the Chicago Department of Business Affairs Consumer Protection webinar. Please note any website or email that I mentioned will be posted in the chat box. For those seeking business license assistance, you can visit the Small Business Center here at City Hall or call 312-74-GO-BIZ. Business license can be applied for or renewed online at chicagobusinessdirect.org. If you are a part of the BACP Entrepreneur Certificate Program, get credit for joining this webinar by sending an email to bacpoutreach@cityofchicago.org. To learn more about this program, please visit chicago.gov/business education. This webinar is being recorded and will be available at youtube.com/Chicago BACP. We would like to encourage all attendees to ask questions. Please use the chat box to send your questions. There will be a Q&A session at the end of this presentation. At this time, I will now turn this webinar over to Sarah Richardson from the Chicago Department of Health for us to begin.
Thank you, Stella and Tara. We can start sharing the slides. My name is Sarah Richardson. I work at the Chicago Department of Public Health in the Office of Behavioral Health. And we are going to talk today about safety for hospitality venues. And as Tara is pulling up the slides, I'll just say this is a partnership between the Chicago Department of Public Health, Rush, who is here today to help us co-present, and then Civil, the Chicago Independent Venue League. Dr. Wilnice Jasmine is here with me from the Department of Public Health, and we have Paige, Tara, and Lisa also presenting from Rush. Each of us will introduce ourselves as we go through. Tara, we can go to the next slide.
Sorry, 1 second.
You're good.
Seems like things are freezing up just a little bit on my end. There we go.
So our agenda today, we have a packed hour. We're going to do a quick introduction, talk a little bit about language and stigma, and then Dr. Jasmine will talk about some of the opioid data in Chicago. Then we'll do a Narcan training and a fentanyl test strip training. Both of those resources will be available to you after this training today. We'll talk a little bit about substance use within the hospitality space in particular and amongst hospitality workers. Talk briefly about a really important opioid treatment resource available to everyone in Illinois. And then we'll tell you basically how you can continue to engage with us, how to access these resources, perhaps answer some important questions you might have in terms of next steps. So I will hand it over to Tara to start us off on the introduction.
Hi, so my name is Tara. I am a nursing student at Rush University, although I'll be graduating next week. I'm also a musician in Chicago, so I kind of by default have worked in the hospitality industry for a long time. And I'm very excited that you all are here today to participate in this programming. It's been a really fun process working with all of these people, and I hope you feel you leave today empowered to save some lives. So essentially, this has been a partnership between the Chicago Department of Public Health, Rush Substance Use Disorder Center of Excellence, as well as the Chicago Independent Venue League. So Rush and Civil came together first to come up with ideas of how we'd be able to get Narcan behind bars, teach staff how to use it and how to identify overdoses. And then CDPH was very gracious in providing resources for us. One thing that is important to mention is that, you know, the conversation around substance use disorder and around overdose and death can be really challenging to have. So if at any point you feel uncomfortable, please leave and come back if you need a break. We want you to feel like you leave this session with some tools and some knowledge that can help save lives, but you obviously need to take care of yourself first. And also, if you choose to bring this material into your businesses and have these conversations with staff, just know that a lot of stuff can come up. And so this could be a great opportunity for communal processing of this trauma, but also just know that it might be difficult for staff members to talk about this as well. So I'm going to play a video of George. He is a bartender at Reno Cafe in Logan Square, and this was his experience witnessing an overdose.
Last year I had an experience while I was bartending, noticing somebody outside on the sidewalk staggering and kind of fumbling, eventually falling down on the sidewalk, practically into the street, and a coworker and I went out to try to help this person, and it was becoming obvious this person was going through some kind of overdose. They were not very cognizant, and they were becoming less and less responsive. We had called paramedics immediately, but we were waiting for them to arrive, and this person was barely hanging on. And it was just terrifying to watch this and to be part of this, and it felt extremely helpless. More knowledge and information and training to be ready for a situation like this would be just absolutely invaluable.
Wonderful. Were people able to hear that? That came through? I'm going to assume yes.
Yes, we were able
Okay,
to.
great. So obviously in this situation, George would have loved to have had the opportunity to have knowledge on how to approach this overdose. If there had been a Narcan supply behind the bar, he could have grabbed that, run out. If he had known how to identify what an opioid overdose was, that would have been really useful for him. And the thing is that a lot of bars, clubs, music venues, lots of hospitality places are actually on the front lines of substance use and overdose, whether or not it's amongst staff or amongst patrons or even just outside of the buildings as well. And so it's important that venues have this information, they have access to training, access to resources, just so they can, feel empowered to help if something like this happens. Yeah.
Last year.
Shoot. Okay. I don't know why this bar is not disappearing. Okay, so harm reduction. If anybody has any idea of what harm reduction is, or any resources or measures that have been coming through, or programming, please feel free to throw those in the chat. Those are great resources for you to share with other people, and it's something that we love to hear about. So harm reduction essentially is the programming, policies, intervention, practices that minimize the negative health effects or social impacts of substance use. And really, it's the focus on the humanity of people who use drugs. I mean, I think it's really important to stress the fact if somebody uses drugs, that doesn't mean that they deserve to die. And that's a really harsh thing to say, but there are a lot of people that kind of view it that way. And for us, we're really just trying to minimize the negative effects of drug use. We don't want to ignore these people. We don't want to condemn these people. If we're in a position where we can help, we should, offer help. We do not attempt to condone or ignore or minimize the negative, condone using drugs or minimize the negative impacts of using drugs. And we want to make sure that as we approach this, that we approach it in a non-judgmental way, non-coercive way, help people, and then point them in the direction of services and resources. And of course, language is very powerful. This really does have a direct impact on the care that people receive. 20 million people in the United States have substance use disorders. Only about 10 of them receive treatment. And a lot of that has to do with stigma. And so if we're very careful with the way that we use our language, we can actually start to break apart these societal, structural, and personal stigmas that can have a very powerful effect on how comfortable people feel moving forward to talk about their substance use disorder, to get help. So it's a thing to think about. And on this next page, you can see that there's a list of what we often see, the words we often see people use, and then the words that we suggest that they use instead. And of course, when you're adopting any new language or thinking about using language differently, we might fumble our words, we might make mistakes, and that's okay. That's how we learn, and that's how we progress. And you can throw in the chat too, if there are any of these words that you see more often than others. We would love to see that there as well. And now I'm going to move on to the next slide. I think Dr. Jasmine will be taking over from there.
Yes, thank you, Tara. So everyone, my name is Dr. Wilnice Jasmine, and I'm the Medical Director of Behavioral Health here at the Chicago Department of Public Health. I'm a physician specializing in both family medicine and preventive medicine, and have been with the health department for a little bit over 3 years now. And so we are very early on in this presentation, and no matter what audience we give this talk to, we always share the local data just to show the impact relating to overdoses occurring across the city as a whole and across different community areas. And so one way of measuring impact is looking at the actual number of people who died from an opioid-related overdose. And around 2013, 2014, 2015, that was the time we saw as a nation a big jump in people dying from opioid-related overdose deaths. And so here on this chart, we have starting from the year 2015 as a starting point here in Chicago. And in more recent years, we've seen alarming increases in the number of people who died from an overdose. In 2020, we saw over a 50% increase in overdose deaths when compared to 2019. And 2021 had the highest number ever recorded since we started tracking this information, similar to what we are seeing nationally. Next slide. Thank you. And so in the previous slide, I reviewed the total number of deaths associated with opioid use in the city. And I want the audience to remember that not every overdose results in a death. And so across the city, there are over 10,000 non-fatal overdoses that occur. Each and every community area has been affected. So when we look at this map here, we see all of the different community areas highlighted. And those that are in a darker blue, those are more heavily impacted by overdoses. And when we look at 2020, the 3 community areas that were most impacted by overdose deaths were Austin, Humboldt Park, and North Lawndale. These individuals, they all could have been saved if they were administered naloxone. We call this medication mainly by its brand name Narcan. So this is why we're here today, to share with you some tools that you can use to join us in helping to save people's lives. Next slide. And when we watch and listen and read the news, we often hear about gun violence. And I want you to know that when we compare the total number of people who died from an opioid-related overdose, in 2020, there were more people who died from an opioid-related overdose than both gun-related homicides and traffic crash fatalities combined. And I'll let that number sit with you. Again, this is the reason why we're reaching out to you today. All of these people could have been saved if they had Narcan available. Next slide. So here we also, when we look at the impact of opioid-related overdose deaths, we look at the impact across gender groups. So you'll see that the preponderance or majority of people who die from opioid overdoses, over 70% were male. And then when we look across the different racial groups, you'll see those who are non-Hispanic Black have the highest impact. So the highest rates of overdose deaths. And earlier this year, CDPH, we reported that there's a 10-year life expectancy gap between Blacks and whites. And one of the top 5 drivers of this gap is opioid-related overdose deaths. And for those who are curious, the other 4 drivers include chronic disease, infectious diseases, infant mortality, and gun-related homicide. So when we look at these differences, it's not inherent due to race, but due to structural racism that impacts policies and investments or historic lack of investments. That's the driver of these differences that we're seeing across different racial groups. And one of the values that CDPH, the Chicago Department of Public Health, holds is to dismantle systemic racism by creating supports that counteract the disparities we see. And so making Narcan freely available in settings like your businesses will go a long way in making access to this life-saving medication equitable. And so we really want you to consider to participate in this program. And I'll move on to the next slide. We also look across different age groups. And so when we look at the different age groups, the highest rates of opioid-related overdose deaths are those between the ages of 45 and 64 years old. Ken, their lives could have been saved with Narcan. And so without further delay, now it's time for the Narcan training. So I'll turn it over to Lisa.
Hi, all right, let's talk about naloxone or Narcan. Next slide, please. All right, so I think it's important that we start out by understanding what an opioid is. So an opioid is a type of drug that is used to temporarily reduce pain. I imagine many, if not most of you, have heard of the term opioid or are familiar with certain opioid drugs. What an opioid does, it attaches to opioid receptors in the brain, and it causes the cells in your body to release signals that reduce pain and increase pleasure and euphoria. On top of that, it also sends signals to the breathing center in our brain that eventually slows down breathing and also impacts other systems in our body as well. So opioids are legally prescribed to treat pain. They're often used in hospitals or in outpatient situations for maybe very severe or serious procedures. So that includes oxycodone, hydrocodone, morphine, codeine, and fentanyl. Fentanyl is prescribed legally, and it is also illegally made. So opioids, as I said, can be illegally manufactured and sold, such as heroin, fentanyl, and carfentanil, and fentanyl in general. So next slide. So many types of drugs can cause overdose. That can be alcohol, Tylenol, other over-the-counter drugs as well. And the symptoms can vary. So when we're talking about an opioid overdose, this happens when an individual's brain is flooded with an opioid drug, which signals our brain to completely stop breathing. And so it's really important to think about certain signs to identify during an opioid overdose. It can range, but some of the most common signs that happen are pinpoint or abnormally small pupils. There's a loss of consciousness and unresponsiveness to outside stimulus, oftentimes shallow, slow, or no breathing at all. The individual can make sort of a snoring sound or even like a rasping breath sound. Skin will turn clammy and kind of a gray or ashen color for darker skinned people, or a bluish or purplish color for lighter skinned people. And oftentimes their lips might even turn blue. Next slide. So this slide is kind of meant more as an FYI. It's important to understand that there are disparities that impact opioid use in certain populations, but I think the biggest takeaway is understanding why certain people are more susceptible to experiencing an opioid overdose as opposed to opioid use. And one of the main components that these populations have in common is the decrease in opioid tolerance after not using for extended periods of time. So if you think about people who may have been incarcerated for a certain amount of time, whether it's months or years, people who may have been in a detox, quote unquote detox or withdrawal management or abstinence-based treatment facility, or even people who chose abstinence during their pregnancy and have decided to use again after birth. Many of these people are at risk for overestimating their tolerance, remembering that their tolerance was maybe high prior when they were using opioids, and then forgetting that after some time of not using, they are more likely to decrease the tolerance and more likely to overdose. Next slide. So let's talk about how we can prevent fatal overdoses. Narcan, which is, as we said, the brand name for the medication naloxone, reverses opioid overdoses. It blocks the effects of opioid drugs on the brain's opioid receptors. And most importantly, it can restore breathing as quickly as 2 to 3 minutes. It's important to note that naloxone or Narcan is not addictive. It is not harmful to someone who is not overdosing on opioids. So for example, if you see someone that is overdosing and you're not sure what they're overdosing, what kind of drugs they've been using, whether it's no opioids at all or a combination, using naloxone, administering this drug will not cause them harm. It may not reverse their overdose, but it won't cause further harm. It's safe to use. And it has no potential for misuse. Another really great thing about this drug is that Illinois law protects non-medical persons who have administered naloxone from civil or criminal liability. And it also protects anyone who is seeking emergency medical help for an overdose. It also allows trained pharmacists to dispense or give out naloxone through a standing order. So individuals can go to a pharmacy and request naloxone, and they won't need a direct prescription from a provider or any kind of insurance as well. And I'm not sure if any of you have heard of Narcan or naloxone before, but maybe you know where you can access it. You can go to any pharmacy and access it. There are, different prices that you might have to pay for it. Your insurance might pay, might cover it, but overall, you don't need a prescription. You don't need insurance to be able to get it. Next slide. All right, so another really important thing I think to talk about, and something that I know maybe as a business owner you might be concerned about. So under Illinois law, it is unlikely that a business would be held criminally or civilly liable if an employee were to administer naloxone to reverse a suspected opioid overdose on business property. And so we have the Drug Overdose Prevention Program Act. And so as long as your employee is not being paid to administer an opioid antagonist and has received basic information about opioid overdoses, and that also includes the instructions that are found on the packaging or the toolkit that we will you'll have access to, we'll distribute at the end of this webinar. And is not committing any sort of intentional or willful misconduct, it is very unlikely that your establishment could be held liable for Narcan administration. With that being said, this information is not intended to be legal advice. So if you have any further questions or concerns about this or about this act, I would encourage you to either put your question in the chat or your contact information, and CDPH will follow up with that. Next slide. All right. So how do you use naloxone or Narcan? First things first, if you suspect that someone is experiencing an opioid overdose, call 911. Get medical attention, seek medical attention immediately. Next, so if you are able to access it quickly, get the Narcan box. There should be 2 nasal sprays available in each box. And so you remove the individual packaging. There should be instructions as well on the box. What you do is you take the nasal spray, you insert it into the nostril of the individual. You insert the tip so that it's high enough into the nostril, and then you create a seal by closing the other nostril. And then that way you can, make sure that the right amount, the maximum amount of medication actually enters the sinuses. You press the bottom of the cartridge firmly, and then this is really important, you stand back. So the reversal may send the person into withdrawal, which can be, if you think about what opioids do for you, it decreases pain, increases euphoria, right? It also decreases your ability to breathe. So people start breathing again, they start waking up, but they also start to feel an immense amount of pain, potentially losing that feeling of euphoria and actually feeling very confused and aggravated. So it's really important just for your safety to stand back, not to overwhelm the person. Sometimes that could make them act aggressively if there's too many people around. So, definitely make sure to protect yourself. So you wait 2 to 3 minutes. If in 2 to 3 minutes they are not breathing and they are not responsive, give a second dose of Narcan. And then also, this is really important, stay on the scene until emergency responders arrive. Naloxone does work for about 30 to 60 minutes, but the person can go back into withdrawal or into an overdose during or after that time frame if they don't get more medical attention. So it's important to stay there, give them another dose if that happens, and make sure that you talk to emergency responders. Next slide. So you administered the naloxone. It's great. However, it's really important that you stay with the person until help arrives. And, let's say that maybe the person is not responding to naloxone. Maybe they've taken other drugs or they didn't take an opioid. In this situation, it's really important to make sure that you keep the airway clear. So you do that by placing them in the recovery position. So you lay them on your side, just like the picture shows in the slide. You want to put one of their hands underneath their head to kind of lift it up a little bit, and make sure that their knee is bent forwards. And this stops them from rolling onto their stomach, which could be very dangerous. So again, I really want to emphasize, because the naloxone reverses the effects of the opioid, which is great to get them breathing again and conscious, but they may wake up feeling confused and upset, agitated, aggressive, and it can be really, really traumatic and a really painful experience, not just for the people surrounding them involved, but the person who's actually experiencing this. They may not even remember overdosing. So, that's why taking a step back yourself, but maybe even at this point, delegating to, somebody else to do kind of crowd control, make sure that no one else is around, or at least far away, so that the situation can be minimized and controlled. Next slide. Lastly, we want to talk about myths about overdose reversal and naloxone. So a cold shower will not revive someone from an overdose. Injecting saline, milk, or any other type of substance also will not revive someone, and can even cause further harm. Putting ice on someone's face or body will not do anything for an overdose. And lastly, Narcan and naloxone, they are not addictive, and it does not encourage opioid use or other substance use. And I don't know if maybe other people have heard about other myths or misconceptions about overdose or naloxone. If you have any questions about that or are concerned, please put the questions in the chat, and we can maybe hopefully have some answers for you or debunk some other myths that we haven't heard about. Next slide.
Okay. So can you move forward one more slide? Okay, thank you. So as some background information, when we talk about fentanyl, for those who aren't aware, fentanyl is a type of opioid related to, is manufactured in a lab. So it's a synthetic opioid. Fentanyl is a type of opioid that's over 50 to 100 times more potent than heroin or morphine. So when someone uses fentanyl, or if the substance they're using contains fentanyl, they're at increased risk of overdose. And when we look at 2020, over 86% of opioid-related overdose deaths in Chicago did involve fentanyl. And so when we look between the years 2019 and 2020, we saw the number of fatalities involving fentanyl increase from almost 700 people to about 1,200 people. And then when we look even closer at the number of people impacted, 38% of deaths involve fentanyl. And so the old adage, knowledge is power, cannot ring more true than in this case. One way that to have knowledge of the substance that you're using is to actually test your substance. So next slide. And so today, I'll go very quickly how to use a fentanyl test strip. So these strips, we're making them available for your organizations to use. And the way they work is that they come in a packet. And then when you take out the actual strip, at the end of the strip, I know it's very small, there'll be one end that has squiggly lines, sort of looks like a liquid or a river or some other body of water. That's the side that you use to dip into the liquid that you're testing. And so we have fentanyl test kits available. And so we usually ask when a person is testing a substance, a very small amount is needed. So the amount would be equivalent to about half of a grain of rice. They would take that amount and then dilute it with water, about 20 or 30 milliliters of water. So you would stir it to make sure that that substance is well diluted, and then you would dip the fentanyl test strip. You dip it and wait 10 to 15 seconds, and then you take it out and then you allow it to dry for about a minute. When you look at the results, you'll see that one line means that the fentanyl is present, and then 2 lines means that it's negative for fentanyl. The test is reading negative for fentanyl. It's a little bit counterintuitive, but that's why we have instructions also available for you to refer to. Can you go to the next slide? So when it comes to fentanyl, there are a lot of myths around the substance and what's effective against it or how you can get exposed to it. Some people may think that fentanyl, because it's so powerful, that it's resistant to naloxone, and that's not true. Naloxone does work. So for some people, they may need an additional dose of naloxone or Narcan before they're revived, but you can administer Narcan and see a reversal in an overdose if fentanyl is involved. Some people may think that touching fentanyl may place you at risk for experiencing an overdose, and that's not true. You cannot overdose by touching fentanyl. Many of the videos you may have seen in social media where people reportedly had overdose after touching fentanyl, many of them have been debunked as untrue. And then when you're thinking about the fentanyl test strips themselves, they can be used to test all different substances in different forms. So heroin, powder form, or pill form. You just have to make sure that you dilute it. If you're testing things like benzodiazepines, benzos, meth, or cocaine or MDMA, you just have to make sure you're using more water to dilute the substance before you test it. And then if it comes in pill form, all you have to do is shave off a tiny amount. So you can use a card, a key, some other metal to shave off that tiny amount and then mix it in the water. Next slide. So again, here, the strips, they tell you yes or no whether fentanyl is present, but it does not tell you how much fentanyl is present. So that's something to keep in mind. It can't tell you whether there's a lot of fentanyl or very little amount of fentanyl present. It just tells you whether it's present or not. Next slide. Okay. And so is it Paige? Are you next?
Yes.
So
Yep.
I'll turn it over to Paige.
Thank you. Yes, so hi everyone, my name is Paige Pickrell. I work for Russia's Substance Use Disorder Center of Excellence as our community research manager. So I'm just going to go over a bit about substance use and hospitality and service industry workers as well. I think a lot of the information we have in Chicago right now in the news is really focusing on making sure patrons stay safe in bars, restaurants, and other service industry venues, but it's also being mindful about how we're keeping our workforce safe as well and making sure we're aware of the kind of environment and accessibility and availability to services that the workforce has. So if we can go to the next slide. So right now we know that drug overdose that have led to deaths in the service industry, and the mortality rate for food prep or the serving sector is 2.8 times higher than the total paid civilian workforce. And the only deaths in any other field that's been higher is construction and extraction. And then service industry is number 2 right after that, which again is still 2.8 times higher than the total paid civilian workforce. And that was as of 2020. And we can go to the next slide. And then when we look at substance use generally among hospitality industry, again, because we did differentiate between when there's substance use overdoses that lead to death versus general substance use. Accommodations and food service is the highest, according to a study done in 2008 to 2012. Substance use among adults aged 18 to 64 employed full-time in the industry category was at a 19.1 rate for food services and the service industry. And then we can go to the next slide. And then same with alcohol use or alcohol use disorder. So disclosed heavy alcohol use among adults aged 18 to 64 employed full-time by industry category. We have food services and service industry within the top 3, only coming under mining or construction. So we're seeing a lot of blue collar jobs that are really heavily affected by any substance use and particularly alcohol use in the area. So we'll talk a little bit about why, but in knowing the industry and knowing your background in the industry, I'm sure there's a couple of pieces that aren't necessarily surprising to you. So we can go to the next slide. So there are many factors that exacerbate substance use in the hospitality sector. So one thing is a high stress environment. Individuals are on their feet, they're working double shifts, they're working long hours. There's a lot of moving parts to it. The labor pool is younger, and we know that the earlier substance use is introduced, the level of severity is going to be higher through life. Typically working low wage jobs and that leading to stress. Irregular work schedules, including late night shifts or doing closings and openings and needing to adjust those sleep schedules. So low management and surveillance. There's a lot of autonomy behind the bar. There's a lot of autonomy in service industry in general. And then work culture norms, doing end of shift drinks, going out after work with your peers, casual substances being discussed and disclosed at the workplace. And then alcohol availability in the workplace. Is there a new menu that everyone has to try? Are there new samples everyone has to try? Again, are we doing end of shift drinks? Are we going out after work? And then having that peer pressure from coworkers. If you don't want to go out for drinks after work, if you're not interested in having your end of shift drink, there's always questions about why or what's happening there. And then same with benefits. There's typically few benefits offered by employers, unfortunately, and few substance use prevention measures in place. So if an individual is feeling that they need to consult a doctor or need to consult substance use services, are they seeing that they have the capacity and access to do that with their current benefits and their current employment, and even with their off hours that they're typically working? And I'll turn it back to Dr. Jasmine about treatment resources.
Thank you. We can move forward. Yeah. So when we think about opioid use disorder, we think of it as a chronic medical condition that can be treated. And when we think of it as a health condition, we know that there are medications that are very effective in helping people stay in recovery. And so the FDA has approved 3 medications, namely buprenorphine, also known as Suboxone, methadone, and naltrexone, also known as Vivitrol. And One thing to keep in mind too is that for all the people who have opioid use disorder, there have been surveys nationwide, and close to 87% of people with an opioid use disorder, they do not receive this medication that can help them maintain their recovery. And so we are talking about this program. We're naming it Medication Assisted Recovery Now. So it's a program that allows people to call the Illinois helpline and connects them to treatment. So can we go to the next slide? So when we're thinking about people who use medications to assist with their recovery versus those who are receiving behavioral therapy alone, when someone does have medication on board, they're more likely to stay in treatment longer. And most importantly, their risk of mortality, it reduces their chances of mortality. So they have 40 to 80% lowered risk of fatal overdose. And so we think of it as treatment, but we also think of it as harm reduction, which is why we're talking about it today with you. Some people may think of treatment as detox, but when we talk about detox or supervised withdrawal by itself, we know that it is not very effective treatment, especially if someone is not connected to the next level of care. Actually, because detox requires someone to completely stop using the drug, if someone then is released after that period of time without any further support, and they go on to start using again, their tolerance has decreased. And so because their tolerance is lower than what it was to begin with, they are actually at increased chance of experiencing an overdose after that detox period. And so that's why we're here to talk and make sure that people know that medications are available to help treat this, this condition, and that we can help you get connected to medication in a timely way. So next slide. So MAR Now, Medication Assisted Recovery, now emphasis for time. Calling this Illinois helpline 833-234-6343. And you can either ask for MAR Now. If you're not familiar with the program name, person can just say that they need help getting connected to treatment for their opioid use or their drug use. And so how this program works is that a case manager will connect the caller to a physician who will be able to do an assessment over the phone. And there are different ways the person can have access to the medication. So the medication, Suboxone, actually can be started at home. And so if person is going to use Suboxone, the physician can write a prescription, send it to the pharmacy, and the case manager can help the person with transportation if that's needed for them to go to the pharmacy, pick up their medication and come home. And then once they're at home starting the medication, the clinic will call back to make sure that everything is going smoothly. The other option is a person can come to the clinic itself. And again, the case manager will help with transportation if that's needed. This program is open to anyone who lives in Illinois. We started as a pilot site here in Chicago back in May, but back in September, it opened up statewide. This program is a partnership with the Illinois Department of Human Services Division of Substance Use Prevention and Recovery. And so that's why it's available statewide. And so I encourage you to share this information with your clients because you never know, you can never tell by looking at someone whether or not they have an opioid use disorder. So to have this information freely available, person would know for themselves if this would apply to them and they would have access to it simply by you sharing this information. And now, next slide. I'll hand it off to Sarah.
All right, I'm having some internet connectivity issues, but I'm hoping you all can hear me. So we want to talk about next steps, what you can do to engage further with us and provide these resources if you are interested at your business. So next slide. There we go. So we will provide, I saw a question in the chat, we'll provide these slides. We'll also provide a toolkit and a fact sheet for you all to take back and review in more depth. But we are also now, now that you've watched the webinar, able to provide you with free Narcan, free fentanyl test strips, posters, coasters, informational brochures, and other information, as well as if you would like sort of more training for your staff. All you have to do is fill out the form that's linked here, and we will send that out in an email as well afterwards. That's just a form that will ask you whether you would kind of like a smaller box of supplies or a larger box of supplies to start you off, where we should mail that, and some other information that will help us get that, get or you can come to our office downtown in the Loop and pick them up. You can reorder these supplies as many times as you would like, and you'll have our contact information in the email that we follow up with and in that form if you have questions and want to kind of understand how this is going to work more. Like I said, we will be providing a bunch of information right after this via email. We also have within the Chicago Department of Public Health, the Office of Substance Use, or OSU, has an email that's listed here in number 4, osu.cdph@cityofchicago.org. You can always, and anyone can always contact us at that email for any kind of questions or requests related to harm reduction or substance use more generally. And then highlighted here, and we will send this around as well, Rush has developed an evaluation tool. So we would greatly appreciate after this training if you would let us know kind of what you learned and what was helpful in this presentation. And Paige has also posted that in the chat. Thank you. Next slide. I have a little delay on my, there we go. So this is just a quick overview of kind of what you could expect in a small versus large box from us in terms of a shipment from the health department. So we will give you Narcan kits, fentanyl test strips, some posters, both sort of promoting the harm reduction access and also some of those ones that talk about the language that Tara was talking about at the beginning of the presentation about using the right types of language to sort of destigmatize this topic. We've also made some coasters. So if you are a bar or other venue like that and you want to have coasters available with sort of harm reduction information, and then the Mar Now program, we have a lot of different information and palm cards and things to promote that program for your staff and for your patrons. So all of that you can expect in the different sort of shipments to you. Next slide. I think I remember the next slide. I'm still operating on a strange internet.
Sorry, I think there's just a delay with it getting to you. Yeah.
Yeah, there we go. And so this is just quick snapshots. This is the types of posters, coasters, sticker type things that we have developed, and we will continue. You know, this is the first time that we're really promoting it in this way to bars and clubs and hospitality type venues. So all of your feedback is really welcome as we continue to develop these materials. But these are just some quick examples of types of materials we have right now available for you all. And I think if we go to the next slide, that is it. We can open it up for any questions. We've got 10 minutes. You can also put questions. I see a few questions in the chat or comments. We will follow up if you would like more training, absolutely. Any other questions from?
Yeah, if there are any other questions, I think you'd be able to unmute yourself, I think, and speak up if you'd like to, or you can just throw those in the chat as well.
If you like, they can raise their hand and I can unmute them. They can.
Oh, beautiful. That's perfect.
So far, no hands are up. Okay, we have one hand up.
Hello, Lawrence.
How are you doing today? I work for Tau Group Hospitality. So I was just wondering, will we be able to get a copy of this seminar? So I can, put this to my staff and the guards.
Yeah, I believe
So we will send out
yeah.
the slides and then, oh, cool. Sorry with this lag. And BACP will be posting this on YouTube.
Okay, I
as
put
well
my
on their
email in the chat as well.
I'm sure you all have access in the different ways. Sorry, Tara.
In addition, Lawrence, Rush will be starting to do some outreach events where we can do in-person trainings with your staff as well. So if that's something you're interested in following up with your staff, you're more than welcome to follow up with me or Tara as we're starting to build that out closer to the spring and in January.
Well, to piggyback off of that, AED training and then like the CPR, stop the bleed would also be helpful. Unfortunately, we've all, work in Chicago and we've seen some of the things that have taken place downtown. We just had that homicide in front of Hush, a bar off of Chicago Avenue. So I think I'm 30 years in law enforcement. I just took over the job as senior manager of security over there. And I'd like to see like a trauma kit at our front door, but also have the guards and staff trained efficiently and that type of stuff.
And I do think overall, eventually, once we get the in-person trainings up and running, just the overall engagement with staff and having people there in person is going to be pretty powerful too. Online seminars are really wonderful, but I think one-on-one communication with the person there too is pretty great.
Absolutely.
And we have another, I think they put their hand down actually.
That's why I'm doing online.
If you have any questions, please feel free to raise your hand and I can unmute you.
Process, but
Not intuitive.
Okay, I am not seeing any more questions. So
Yeah, me
I
either.
think,
You
yeah,
check
we
the
can
chat in the
probably,
Q&A box.
oh, there's also a Q&A box. I don't see any questions there.
Unless Lawrence has another question and his hand went back up. Let's see.
I don't know how that happened. I didn't
No.
even touch anything.
I don't think it went down.
Okay, we do have
so
another
it's the
question.
same.
All right, thank you, Lawrence. Oh, I guess she put her hand back down. Ooh,
Oh,
okay, well, I guess that's it.
well, again, thank you to everybody for coming out. This has been really wonderful for us to finally present this information. It's very important to us, and we hope that you take a lot away from this too.
Thank you, ladies, for today's presentation. I hope all of our attendees got the much information that they were looking for. If you are a part of the BACP Entrepreneur Certificate Program, please send us an email to bacpoutreach@cityofchicago.org to receive credit for today's webinar. Again, that email address is bacpoutreach@cityofchicago.org. To learn more about our upcoming webinars, please visit chicago.gov/business education. Again, that website is chicago.gov/business education. Thank you. Then thank you again to the health department.
Thank you.